My name is Dr. Emily Prevo. I'm a physician with Holland Hospital Family Medicine. Type 2 diabetes is a disease where there's dysfunction in the breakdown and usage of sugar throughout your body. This is due to a decreased production and response to the hormone insulin. Diabetes is diagnosed based on lab results that you get from your doctor's office. You may not feel any different prior to diagnosis, but the most common symptoms are increased thirst, increased hunger, increased urination, and blurry vision. For both prevention and management of diabetes, there are some important lifestyle changes you can make at home. If you are overweight or obese, just losing 5 to 10% of your body weight can have a huge impact. This is typically done through diet and exercise. There are several diets that may be acceptable. However, the key is including fruits, vegetables, and whole grains in your diet while trying to limit saturated fat, processed foods, and sugary beverages. Physical activity plays a huge role in weight loss and overall health. It is recommended to have a regular, moderate exercise regimen totaling about 150 minutes per week. Managing blood glucose levels is important to prevent the long-term complications of diabetes. Having prolonged elevated glucose in your blood can lead to damage to the small vessels in your body, particularly those of your feet, eyes, and kidneys. Having diabetes also increases your overall cardiovascular risk. People with diabetes are 2 to 3 times more likely to suffer from heart attack or stroke. It is important to monitor and control other important risk factors for cardiovascular health, also described as the ABCs of diabetes. The A stands for hemoglobin A1C. This is a lab value that we monitor to help determine what your blood sugars are over a 3-month period of time. B stands for blood pressure. This is routinely checked at your office visits. Hypertension describes blood pressure that is persistently elevated. This can be managed with both medications and diet and exercise. The goal is to keep your blood pressure less than 140/90. C represents your cholesterol. Your LDL, or bad cholesterol, increases your cardiovascular risk when it is elevated. Using lifestyle modifications and diet, we can lower your LDL to help improve your overall cardiovascular risk. When screening for and treating type 2 diabetes, the goal is to prevent long-term complications that can be detrimental later in life. If you have any questions or further concerns about diabetes, please contact our office today to make an appointment.